if you are in this trimester, congratulations. You are almost hitting the nail. Welcome once more to the nurses or the midwives newsroom. And so today we are following pregnancy and heading to the end of pregnancy. We are talking about that trimester of pregnancy. What do we expect? So if you are in this trimester, congratulations. And so I want to talk about some of the things that we expect in this trimester. And number one, you may have some abdominal pains. Low abdominal pains could be due to pressure of the baby at the pelvic, and so this one is normal. Do less of walking when you feel this pain. Some people are even unable to walk properly, and so at that time just take a rest. You can lie down and then continue moving, and also avoiding a lot of walking and standing at the same for a very long time. It is important to take care of yourself at this trimester. I know it is a more exciting and nice moment. At this time you're thinking about delivery and the baby and how to welcome this baby home. And next, you could have some swelling of the ankles, at the ankles. This one happens in many women, and it is especially due to a lot of standing and maybe sitting for so long. Fluid balance is usually a bit affected because of the normal body processes in pregnancy. And so you need to just take care of yourself, elevate your limbs when you're lying down or even when you're seated, and avoid standing or walking for so long. If your job demands you to walk for so long, take rests in and out. And next, if you have some tingling at the legs or at the hands, this one it is normal. Just avoid so much movements of the hands. That is, you move so many movements. Just make them minimal and relax. Bathe with some warm water. Avoid using cold items or complexions so much, and it will be good for you. You have some hemorrhoids, especially at the rectum. It is going to have your doctor prescribe some stool softeners to avoid the discomfort and bleeding. If you have some back pain is due to pressure. Avoid lifting very heavy things, a lot of work or excessive exercise. It could cause back pain, and it could also cause you some issues with your back afterwards. So just avoid lifting very heavy things because they will cause you to have some issues later. We may have varicose veins. Varicose veins are protruding veins. They could be bluish, and these veins come due to remember there's a lot of blood movement, and sometimes the veins are overwhelmed by handling the pressure of the blood. And so if you have varicose veins, it is good to have some pressure stockings. They're important. You can have them, and also avoid walking a lot and standing a lot for very long time. Puffiness of the face could also occur. If it is quite much or sudden, it is going to visit your doctor for review, for you to have some checkups and just confirm that you're doing okay. You may have your pressures checked and just have some tests done, and this one will reveal any of the issues that you could be having. You have some leaking of any fluid from the breast or breast growing. This is a normal process in pregnancy, and it should happen at this time. So if any fluid leaking, it is preparation for lactation. So breast pads can help if it is quite much, although it couldn't be so much at this time. So it is preparation for lactation, and it is important to just know that it is normal and good. Next, any vaginal discharge that is bloody is not normal, so it should be maybe whitish or clear. But if it gets to odor, it has some odor, please report to your doctor. It could be a sign of some infections. If it is bloody, it is also a danger sign. So have it reported and checked by your doctor to confirm that everything is okay. There's also another issue that you could have due to the pressure of the abdomen on the diaphragm. This is because the abdomen is really growing, and so just take deep breaths. Ensure you sleep in very comfortable positions. If shortness of breath is too much and causes you to have breathing problems, visit your doctor for review, and it is very important. Also, if you have any stretch marks, just know it is normal, because they come due to a lot of growth at the abdomen, that the skin has to be stretched for it to accommodate the fetus. If the fetal movements have reduced, remember this baby is having less space to play around, and so if the movements have reduced, there is no alarm, but monitor them, because in 8 hours you should not lack a good fetal movement. So keep monitoring the fetal movements and visit your doctor in case you realize that they are taking quite long without having a fetal movement. Now, these are the things that you feel or you have or expect at this time, and you remember to watch the video on preparation for delivery. Remember, you need to prepare at this time so that the baby doesn't find you not ready. You need to seek for help. If you have other babies, seek for help. It is really overwhelming to take care of babies, many babies, and also have a newborn as a new puerperium mother. And so have a clue of somebody who will take care of you during the time of going to the hospital and coming back. Remember also to ensure that your shopping bag or your delivery bag is ready. This is the time the individual birth plan is completed, and it should be complete. Remember to check that your things are ready. Avoid rushing at the last time, and also eat healthy. Continue eating very healthy foods, vegetables, eat proteins, eat balanced diet, and start on a balanced diet. Remember to do exercise. If you have pre-existing conditions, any diabetes or hypertension, your doctor will advise you on exercise, and so do good exercise. But if you have a history of cervical incompetence, that is, you have had abortions or miscarriages before, it is good also to ask for advice from your doctor on exercise. So I wish you all the best, and thank you so much for following. Subscribe and keep ringing the bell so that you get the notices when the video comes. Any question, just post it at the comment section and it will be answered.